Hello and welcome to this presentation. We will be talking about community interpreting. What is community interpreting? It's very common that people would define community interpreting simply as all sorts of interpreting that are not conference interpreting. But really, what is community interpreting? It is a type of interpreting service. It is usually community-based. It's not an organizational situation, so you are not in one big organization that is holding an event. It's vital for the communities, especially those with large number of ethnic minorities who speak languages other than English, in the case of the United States, for example. It enables those minorities to access services where, due to the language barrier, they would miss. So they would access justice, they would access healthcare, they would access education, and so many other services, which would have been very difficult to access if it were not for community interpreters. There are challenges to the role of the community interpreter. Community interpreter usually happens in asymmetrical encounters where the speakers of other languages, the LEP in the US context, is usually a member of a marginalized minority or of lesser power or socioeconomic status. Think here of doctor-patient appointments or in court hearings where only the witness or the suspect or so on does not speak the language. So there is a lot of power struggle and power differences between the different players in the encounter. Now this brings the idea of who is in charge, the idea of patronage and service. How the interpreting service is delivered is often a function of the institutional factors that call for community interpreting in the first place. The party of the lower status receives this service for free at the expense of the institution. So the institution, as we said, can be the court or the hospital or the school and so on. That's why the official or the person who is representing this institution is in a superior position. And that is why it seems that they are the ones who set the ground rules of how this service is delivered. This takes us to the issue of voice and invoice. Community interpreters indeed give a voice to those in need. Providing this service is what guarantees equal access to the service. But there is often a lack of emphasis on the quality. Meanwhile, interpreters need to navigate between representing the communicating parties and their own needs, such as training, adequate pay, and working conditions, as well as the demands of the party or institution that hired them. So there are a lot of interests at stake for all the parties, but they are not always aligned. Now this takes us to the idea of language access. In fact, community interpreting is driven by the idea of language access, which means providing limited English proficient people with reasonable access to the same services as English-speaking individuals. In the United States, language access is guaranteed by the law. There is first the Civil Rights Act that prohibits discrimination based on national origin, and then an executive order that affirms language access requirements and outlines additional requirements. In some cases, there are individual states and municipalities that have enacted their own language access regulations. So, who offers language access? Anyone, any entity that receives federal support, even if it is indirect, is required to provide language access. It applies to an entire program or an activity, which means that all parts of a recipient, the one who receives the funds, all the parts of their operations are covered, regardless of whether the recipient is only partially funded through federal funds or not. That makes language access requirements relevant to a wide variety of programs, organizations, and agencies. What does that mean? Recipients of federal funds must take reasonable steps to ensure that LEP individuals have meaningful access to their activities and programs. Reasonable steps. They should provide translation and interpretation to the languages that they often encounter in their community. But it's unreasonable to say that they will translate every single document to every single language that happens to exist on Earth. But at the same time, it has to be meaningful access, real access that enables people to benefit from the service. So not a bad translation or just give the person a document written in whatever language instead of explaining it to them and providing them with the same opportunity an English speaker would have been provided with. An agency provides meaningful access to its program when the language assistance provided is accurate, timely, and effective, and is always at no cost to the LEP individual. This applies, as we said, to translation and to interpreting. Now let's move to interpreting in educational settings, and this is one of the areas of work for community interpreters. Until now, there is no formal definition, but there is a suggested one. Educational interpreting is a specialization of community interpreting that facilitates access to educational services in schools and other educational settings. There is now a National Association of Educational Translators and Interpreters of Spoken Languages, as well as some other organizations that are starting to emerge. They are also working on a new code of ethics for educational interpreting. Educational interpreters work in interviews, during enrollment, IEP meetings, physical, occupational, and speech therapy meetings, in-person parent-teacher conferences and meetings, school events and conferences, phone calls to parents, and of course, virtual meetings of any kind. It may seem like an easy job, but it's not. There are sometimes very complex administrative meetings that need advanced simultaneous skills and also working with a team, with a partner. Sometimes you need to sight translate very complex legal documents or technical documents and do that in front of a public audience of parents and other stakeholders. There is also a diversity of topics in special education services. There you can be in a medical meeting, you can discuss developmental issues, psychological issues, legal issues. So there are so many topics. It's a new field, relatively new field in community interpreting that is very interesting and is in high demand. So this brings me to the end of this presentation. Thank you for listening.